This is the idyllic-seeming countryside of Walaita Zone, southern Ethiopia. Rolling hills are covered with trees and shrubs, and crops grow well in the fertile soil. The way of life is very simple. People plough fields with oxen, plant seeds, and harvest their crops by hand. But here, and in many other parts of highland Ethiopia, the combination of red clay soil, high altitude and rainfall, and extreme poverty gives rise to a terrible disease. Mossy foot, or podoconiosis, is a problem affecting the lower legs caused by silicate particles in red clay soil. It affects subsistence farmers who cannot afford shoes or even the water to wash their feet. In Ethiopia, over 1 million are affected, and people in at least 10 other countries in tropical Africa are also burdened with the disease. People with mossy foot in Walaita Zone are fortunate. 10 years ago, the Mossy Foot Treatment and Prevention Association was started up by an Ethiopian surgeon working alongside an American surgeon. The coordinating office is in Sodo town, but more than 90% of its activities are based in the surrounding community. Leah is one of 30 community agents. She lives and works in Gasuba, a town 40 kilometres from Sodo. Like all the community agents, Leah is a mossy foot patient who knows what it is like to suffer with the condition and now works to help others in her community.
Koiro tawa feta yeletio saaten way taaye feta yeletio saaten tana gede sakkenna salame dayde yeletas segape simin gede kittis kittin gede afe gede kittido afe dende dagan kayfe cannaqettada hayqana gada asay uyidi hayqiyoga marziya ka shammada hega ka uyana gada shammada so kadayin hega fuka ta kushafe asay wotti ekin asay kana gada mitta xeri fude kiyada kaqettadani hegafe wodoro ta qoren yegidoga ka qanxidi asay saan wottin yaatin ubbaton yeekay dene cannaqetta edene days qassi gede hagetage fetana sakidi anin cannaqettada giya baanaw dandayke ogiya kare kiyanaw hemetanaw ay hananaw ka dandayke kayfe saketta days.
The Mossy Foot Association makes very good use of their most important resource, mossy foot patients. Patients are trained to give care to other patients in their community and to bring prevention messages to the community through meetings in schools, churches and mosques. Because the tendency to develop mossy foot is partly inherited, the Mossy Foot Association is now distributing shoes to 20,000 children of affected families.
That make the shoes for the clinic are mossy foot patients. The people that are the healthcare agents are mossy foot patients. The people that are the social workers are the mossy foot patients. So another thing that I think is really rewarding about the project is that we see people that have been helped that have mossy foot disease. The girls that have hairdressing training are coming back to the clinics on the clinic day and helping out. The young men that have carpentry are doing the same thing.
Tam Mamech is a good example of a mossy foot patient who has overcome severe disease and now is one of the shoemaking team.
ስራ ሲጀምር እኔ በሽተኛ ነበርኩኝ እግር ህሙማን ነበርኩኝ በቤተሰቦችም በሌላው ህብረተሰብም ዘንድ በጣም የተጸየፍኩና በጣም የተጠላው ሰው ነበርኩኝ ከዚህ በፊት ማለቴ ነው
This team produces 300 pairs of strong leather shoes each month so that other patients can protect their feet. Like many patients, Abebe was dismissed from school because of his disease. He has retrained as a barber thanks to the vocational training program that gives young patients a second chance to develop skills and earn a living. Many patients, like Tammamej, experience severe stigma. The Mossy Foot Association has a holistic approach to care of patients, offering pastoral and social support as well as medical treatment. Pastor Zaudi heads up the pastoral care team.
In the clinic side, we teach people that this Mossy foot problem is not contagious. It's not going from person to person just because they greeted them or talked with them or share a common life. And that's what we are doing in the clinic side. But even more than that, what we are doing that is because these people lacked love from their family, from their friends, from their relatives. We show them, we tell them that God loves them.
Women with Mossy foot are particularly vulnerable. Some are abandoned by their husbands and children. Others become vulnerable as widows. The Mossy Foot Association has introduced a microcredit scheme to help these women rebuild their lives. More than 90% of patients with Mossy foot can be treated in the community. They are shown how to treat themselves with good foot hygiene, dilute bleach, simple ointments, socks and shoes. Many get measurable improvements after only a few weeks of this treatment.
We have stages of disease. If the patient, we say the first and the second stage patient, we can spend it with this patient only $8 in a month to treat a patient, including the surgical operation, everything, rehabilitation. It goes about $280.
A few patients require surgery for foot deformities that prevent them wearing shoes. Kebede has had surgery on his left foot and is waiting until that heals enough for him to have surgery on the right foot too. In addition to prevention and treatment of Mossy foot, the association is also active in research. Research has documented the economic and social burden of Mossy foot, developed a way of grading the severity of the condition, and explored its genetic basis.
First and foremost, this is an ignored public health problem, and we found this also based on our research, and doing research helps to inform policymakers, donors and the community to be actively involved in prevention and treatment of the problem, most of all.
But all those involved in the work of the Mossy Foot Association are aware that for every patient treated, there are at least another 20 untreated in other parts of Ethiopia.
We need to take Mossy foot from a Wolatha project to an Ethiopian project to an African project and finally to a world project.
It's probably the only non-communicable disease that could be completely eradicated.
Tayech was once scorned and stigmatised for the deformity and stench of her feet. Through the Mossy Foot Association, she is now training to become a beauty therapist. She will make a living offering hairdressing and beauty treatments to the community that once despised her. This is a truly remarkable transformation.